I'm Dr. Ambika from My Private Dentist, and today I'm going to be getting into how to look after your retainer. I get it. You've had your braces or your clear aligners, you've got them off, your teeth are looking good, you're smiling, you're feeling great, and you've been given this bit of plastic to keep your teeth in position. You've done the hard work already, right? Wrong. Yes, your teeth are looking great, but if you want them to stay looking great, then these little bits of plastic, these retainers are really important for keeping your teeth in position. I usually recommend wearing them full time for the first 4 to 6 weeks. Now, full time means all day, all night. You take them out to brush your teeth, take them out to eat or drink anything apart from cold water, and for any contact sports and swimming. After that, I want you to wear them every single night. After the first year, technically you could reduce wear a little bit. You could go to alternate nights. But my advice, if you want to keep your teeth in position, wear them every single night, which means lots of use, lots of wear. So we want to be making sure we're looking after them really well to get the most out of them. Now, looking after them really well means cleaning them in a safe and effective way and storing them safely. In this video, I'm going to be talking about a few products that you can use to keep your retainers looking good, and they'll be listed in the description below. So if you're interested, you can check that out too. Now, if you have aligners or retainers and you're wearing them during the day, there's a few things that you should never do. Do not eat or drink anything apart from cold, still water with your retainers in. Definitely don't drink coffee. Definitely don't eat anything sugary or sweet. It's a bit gross. Food and drink get stuck inside the retainers. Coffee will stain your retainers. It's just not a good look. When you got your retainers, you would have been given a box, something like this, from your dentist. Now, it's really important to keep your retainers in this box when you're not wearing them, especially if you've got pets. Now, I've heard lots of stories of people with pets, dogs, who chew their retainers and they come back needing new ones. Apparently, dogs have a real affinity for oral appliances, so it's really important that you've got them stored away. If you got one from your dentist, that's great. If not, then I would recommend something like this. Now, this is the Zima Go. It's a really sturdy steel case that not only will protect your retainers when you're not wearing them, say if you're on the go, but they also have built-in UV disinfection. So say if you're wearing your retainers during the day and you want to have some lunch, you take them out, you pop them in here. There's a little button on the back, and when you press that, in 1 minute, it does a complete UV disinfection. It charges really quickly at home, and it's got a great battery life. I hardly have to charge mine, and it just keeps going and going. And I keep it in my bag handy if I need it. They are a little bit on the pricey side. It is a bit of a luxury product, but I definitely recommend it, and I really like mine. It's not a bad idea to take your retainers to your dentist appointments or to any orthodontist reviews, just so that they can check that they're still fitting well, they're still fit for purpose, and that there's no sign of damage. Watch out for any signs of cracks or breakage, because if they're not fitting well, then they won't be keeping your teeth in position, and then there is a risk of relapse. It's really important to keep your retainers hygienically clean. There are a few methods that you could try. My favourite is ultrasonic cleaning, but I'll go through all of them with you. So the first is good old soap and water. Get a really soft toothbrush. It's a good idea to have a toothbrush separate to the one that you use at home to brush your teeth, but a really soft toothbrush and hand soap or body soap. Don't use toothpaste. Toothpaste is too abrasive and it can make grooves and marks in your retainers. Now, those grooves and marks will wear your retainers, but they'll also harbour bacteria and odours. Also, don't use hot water, only lukewarm water. If you use anything too hot, it can warp and damage your retainers, so it's not a good idea. You can get, as well, little effervescent tablets, retainer tablets, that you drop one of those in a container of water. Leave your retainers soaking for 15 to 20 minutes, and that will dislodge any build-up of grime or bacteria, after which you take them out, you rinse them, and you give them a gentle scrub with your toothbrush. I really like Retainer Bright. They're cheap, they do the job really well. However, there's lots of different ones that you can get. If you've had your retainers for a really long time and you started to notice that they've gone dull and discoloured, or maybe you're getting white spots on them, then that is calcified deposits from your saliva, and it can be really difficult to get them out. It's a good idea to try and avoid them from building up, so keeping your retainers super clean from the outset is important. However, if they aren't looking their best, you could take them to your dentist, who could send them off to be professionally cleaned. Some people advocate soaking them in vinegar for a while to dislodge any buildup. However, I wouldn't recommend using anything apart from water or the effervescent tablets to clean them. My favourite way, and what I recommend to all my patients, is to use an ultrasonic cleaning pod for cleaning their retainers. I use the Zima Pod Pro, although there are other ultrasonic cleaners, but this one's great. Not only is it compact, it's sleek, it looks pretty good, it does the job really well. Now, the Zima Pod Pro has 2 cycles. It has a 5-minute cleaning, which will thoroughly disinfect and clean your appliances, but it also has a max deep burst cleaning mode, which is 15-minute cycle. So if you've got older retainers and you want to get them super clean, then you can double click on here on the start button, and that will give them an extra boost to remove tough stain. It looks sleek, it's compact, it goes on my bedside table, and I use it every night. It's durable and it lasts well. The Zima Pod with just cold or lukewarm water will give them a thorough disinfection. However, if you want them to taste a bit fresher, then I would recommend using effervescent tablets as well. Zima have their own brand of effervescent tablets, but I use Retainer Bright, which is a little bit cheaper and works in exactly the same way. Personally, I don't use them every day. I use them about once a week. It's not a bad idea to have a spare set of retainers too. If you do have 2 sets, don't leave one just in the cupboard. It's a really good idea to keep changing them out, to making sure that they're both sets are fitting securely and well. Invisalign offer Vivera retainers, which are really well made, they fit super well, and they're very comfortable. They recommend replacing your retainers every 9 months, and that can get quite expensive. So if you're looking after your retainers really well, keeping them clean and storing them safely, then I think you could squeeze a lot more out of them. If you have retainers and they're not fitting very well, then what should you do? If your retainers feel really tight or sore to put in, then it's possibly because you haven't been wearing them regularly and that your teeth have moved a little bit. If it's only moved slightly, then you might be able to have some success with wearing your retainers full time for 4 to 6 weeks. Sometimes doing that is enough to just get your teeth back into position. If that doesn't work, then you may need a new set of retainers. It's not a good idea to persevere with retainers that don't fit, because they won't fit snugly around the teeth, they won't keep them in position, and your teeth will move. If your retainers are uncomfortable, go to your dentist and let them have a check. You might need new ones. A new set of retainers, if your teeth have moved, won't move your teeth back into position. However, it will prevent them from moving any further. Sometimes a dentist might place a fixed bonded retainer as well as giving you removable retainers. Fixed bonded retainers are a little wire that fits just on the back of your top and bottom teeth. It's not anything that anyone else can see, but it just helps as a bit of added security to keep your teeth in position. They do not replace removable retainers. You still need to wear your removable retainer every night to prevent your teeth from moving. Fixed bonded retainers aren't appropriate for everyone, and you need to have really good oral hygiene because they can accumulate plaque and calculus at the back and could make gum issues worse. So if you're interested, it's worth talking to your dentist about whether a fixed bonded retainer would be a good option for you. I hope this was helpful. If you have any questions, then drop me a message in the comments and I'll do my best to help. As always, it's really important to see your dentist regularly for personalised advice and recommendation for your teeth and gums, so make sure you go to your checkups. If you enjoyed this video, then please like and subscribe. It really helps our small channel to grow. Thanks, see you on the next one.